How Appalachian states are addressing the opioid crisis. 1. The scope of the crisis. The opioid crisis has hit Appalachian states like West Virginia, Kentucky, Tennessee, and Ohio particularly hard. High rates of addiction, overdose deaths, and the social and economic impacts have made addressing this issue a top priority in the region. 2. Government initiatives. State governments in the Appalachian region have implemented a range of initiatives to combat the opioid crisis. These include expanding access to treatment services, increasing funding for addiction recovery programs, and enacting laws to reduce the availability of prescription opioids. 3. Community-based approaches. Community organizations play a crucial role in addressing the opioid crisis. Many towns and cities in Appalachia have developed grassroots efforts to support those struggling with addiction, including peer support networks, outreach programs, and education initiatives aimed at prevention. 4. Improving access to treatment. Expanding access to treatment for opioid addiction is a critical focus in Appalachian states. This includes increasing the availability of medication-assisted treatment, MAT, outpatient counseling, and inpatient rehabilitation centers. Telemedicine has also become an essential tool for reaching rural populations. 5. Harm reduction strategies. Harm reduction strategies are being implemented to reduce the immediate risks associated with opioid use. Programs like needle exchanges, naloxone distribution, and supervised consumption spaces are helping to prevent overdose deaths and the spread of infectious diseases in the region. 6. Law enforcement and criminal justice reform. Law enforcement agencies are taking a more nuanced approach to the opioid crisis, focusing on reducing the supply of illegal opioids while also supporting addiction treatment for those caught in the criminal justice system. Some states are diverting nonviolent offenders into treatment programs rather than incarceration. 7. Public awareness campaigns. Raising public awareness about the dangers of opioid misuse and the availability of treatment options is a key strategy in Appalachia. Public health campaigns aim to educate residents about the risks of opioid addiction, promote safe medication practices, and reduce the stigma associated with seeking help. 8. Addressing economic and social factors. Economic hardship and social challenges in Appalachian states contribute to the opioid crisis. Efforts to address these underlying factors include job training programs, economic development initiatives, and improving access to education and healthcare services to create more resilient communities. 9. Collaboration and partnerships. Combating the opioid crisis requires collaboration across multiple sectors. Appalachian states are fostering partnerships between healthcare providers, law enforcement, community organizations, and government agencies to create comprehensive, coordinated responses to the epidemic. 10. Long-term outlook. While significant challenges remain, the efforts of Appalachian states to address the opioid crisis show promise. Continued investment in treatment, prevention, and community support, along with addressing the broader social and economic issues, will be essential for long-term success in combating this public health emergency.